I want to make him wait because he's a doctor and he's an emergency room doctor, and I never know if he's a pager going off or anything. And you heard him on the show. We were in New York when we had him on, so it was over a phone. Now he's live in studio in the Toronto studios, and a buddy of mine, but someone who's very bright and all over the media right now, Dr. Brett Belchetz. How are you?
I'm great. Thanks so much for having me.
Nice to see you, bud.
Well, I got to be honest, I always get a little flustered with your introductions because they're so nice. I almost don't even know how to reply to them or live up to them.
Yeah, it's kind of the thing I've been doing well here, Jay. Rick Mercer just said it too. It's like I think I blow a lot of smoke up people's ass at the beginning and the end, and they forget what happened in the middle, and then they always come back. So it's difficult like that. So first off, Brett, I have to congratulate you. You're everywhere right now, and I mean you're on CBC. You're doing stuff for Sun. You're doing stuff on CTV at times. That's cool. How does this? Is this fun for you getting into the world of media right now? Even though you really are a doctor at the end of the day.
Yeah, well, you know what? It's a tremendous change for me. It's a huge difference in terms of the kind of work that I've been doing, but I really do enjoy it because, you know, being a physician is an amazing job. It's really rewarding. We get to help people, but in the end, it really is. It's a job where it's a profession, where you have your professional tasks, you get used to them, you do them over and over, and after a while, yes, it feels good, but there isn't the creative challenge that there was when I first started practicing medicine. So to be able to actually do something a little bit greater where I get to be in the media, talk about problems, help to educate the public, it's really fun. It's like a new challenge for me, and I enjoy it tremendously.
How many middle-aged housewives just love you?
Well, I'm going to say I don't quite know the answer to that question, but I will say I've gotten a few disturbing emails since I first started appearing on television. Yep.
That will happen. Yeah. That's wild. They'll find you. I mean, they know you're successful. Look, Jay, look at this guy. Like, I mean, is that not Dr. McDreamy over here?
That's a handsome fellow, right?
Yeah, like ridiculous, right?
Yeah.
Well,
like
I would have kind of hoped that line was coming from a non-bearded man, but regardless, it's always good to hear.
We didn't shower today, for the record. I was in a bit of a rush. Lots going on. It's true. I was so unorganized for this show. But listen, I think it's really cool. And is there, do you have plans in terms of, like, are we going to see a lot more of Dr. Brett, do you think, in the media? Is that the deal?
Well, you know, it's always hard to say. It seems like things have sort of come out of the blue for me in the media domain. And a lot of it, I think, revolves around the fact that there just have been so many crisis stories around healthcare lately. So, you know, you have this Ebola story, which is just growing dramatically. You have the enterovirus D68 outbreak, which has grown just like crazy. And here in Toronto, obviously, there was the big story about Rob Ford being diagnosed with cancer. So it just seems that we've been in a time where there's one story after another, where people are saying, we want a doctor to answer questions. So, you know, lately it's really blown up. The question is what's to come. I really don't know. I mean, you know, a lot of the stations that I've appeared on seem to really be enjoying having the expert voice, and a lot of them seem to, you know, want to talk about having me on a little bit more, but who knows? You know, I feel like these health stories come and go, and they may all die down, and you may not see me at all going forward. It's hard to say.
But there's always stuff in the news that's going to relate and pertain to having an expert, which in the medical field. And then basically the point I was getting at is if you do anything with one of these stations or all these stations, could you please make sure to come back here? Because we're friends at the end of the day.
Well, you know, well, yeah, no, I got to say one thing, and I said this to you after the last time I was on your show, is that throughout all of the things that I have done in the media over the last few months, they're all very serious. We're talking about very serious topics, and I have to put on a very stern face. And the one thing that I really enjoyed about being on your show is it was the one time that I actually got to laugh a little bit, and the tone was really fun, and it's a really refreshing change because I almost feel like I've become the doctor of doom and gloom because all I ever talk about is things that are killing people, and that's not a good thing.
So let's do an official report. Jay, you be like our health expert who's going to our now professional doctor expert and ask him about this Ebola. Like, let's do it news style. Do you have a stinger, Tommy, or is that what you're looking for? I want to do this like real professional, and let Dr. Brett here in studio get his stern face on. Hey guys, sorry you haven't played your song yet, by the way, Jeff and Roddy. We got right into it with Rick Mercer. It was sort of like we just got right into that with Mr. Mercer. That was a fun interview. Do you have a news stinger there? I'm trying to delay time. That's why. Here we go. Breaking news. All right. Heard better breaking news stingers.
Yeah, it sounds kind of scary.
Yeah, like kind of. This is good for Jay.
Doctor, recent reports out of Texas suggest that the best way to prevent Ebola is to bite random people to gain a tolerance against the virus. Can you confirm or deny this is fact?
Well, you know,
he throws me off guard all the time, too.
Honestly,
I've been biting people since sundown, and I feel better than ever.
Well, I'm just going to slide my chair a little bit further away from you right now.
Don't worry, I don't have my fangs in. News.
I'm gonna say that the music seems very appropriate to that question. Number one. Number two, I think you're going about it perfectly. I think you should keep doing that, and all the power to you.
I've been coughing up blood for the last 3 months. Is that a long form of Ebola, or am I okay?
Well, I think clearly you've developed some tolerance to the virus, and I think that's fantastic for you. And I wish you all the best.
Where's the best place to sell a kidney?
I would probably say, either Craigslist or Kijiji would be top of the list.
Okay, this Ebola thing, though, really, Dr. Brett, is it something that people have to be worried about? And the truth is this, I live close to what they designated as the hospital for Ebola patients, if they happen to have it or symptoms of it. And I'm like literally right around the corner from it. And I said to my wife, I'm like, okay, I'm coming in the back door, which is like a little bit.
Wow.
What?
Wow, that's pretty forward, Todd. I don't know if that's going to help Ebola at all.
Oh, that's not the cure?
No.
Okay, I thought it was. And no, but really, is it something that any of us have to worry about?
Well, number one, I'm going to try to forget the way you phrased that question, but and especially because I am a friend of your wife as well, and the imagery is not pretty. But so to answer your question, yes, we should be concerned about this because. However you look at it, even if it never makes it over here, I mean, this is a huge health crisis. The latest projections say, and just to be deadly serious here, the latest projections say we may have as many as 1.4 million cases of Ebola in Africa as of January of 2015.
Really?
So this is huge. I mean, this is something that is going to devastate Africa. It is out of all control, and nobody really right now has a strategy for how we're going to contain it in Africa. So yes, we should be concerned because we're talking about an entire continent that is getting devastated by this. The other question is, should we be concerned about it coming over here? And I'm going to say, for sure, there will be cases that are going to come over. This one that happened in Dallas will not be the last one because when you have so many people that are infected over in Africa, at some point, those people will make it over to North America and to Europe because the incubation period of this virus is up to 3 weeks. So people will get on planes thinking they're fine, and then they get here and they get sick. Do we have to worry about a huge outbreak here? I don't think so. It's a very hard illness to catch. Okay, we talked about it when I was on air with you before. Most people are not going to get it here. What you don't want to be is you don't want to be the first person that bumps into the guy with Ebola as he gets off the plane. But in general, your odds of getting sick here from it are very low. Our odds of having a big outbreak of it here are almost zero. We'll get it underhand here, no problem. But it's awful.
Do medical professionals, doctors, nurses, whatever, do they start to fear new diseases? I mean, do people ever quit the profession and stuff? Like, when SARS happened and, I read something, I don't know if you're comfortable with me talking about it, but on your Facebook about how you're exposed to, well, no, can we talk about it?
We can talk about it for sure.
So you were exposed to SARS and you were quarantined for a little bit because the patient came in who lied about I think he lied about having it, right?
Yeah, so this happened to me about 10 years ago during the SARS epidemic, and this was an awful experience. So I was working at Sunnybrook at the time, and at that point in time, our only way of labeling people and identifying people as high risk for SARS was somebody who had a cough and a fever who had been in an area where we knew there was high risk of exposure. So I saw a gentleman who had denied all of the exposure zones that we looked at. So we looked at people that had traveled to the affected regions of the world, people that had been to Scarborough Grace Hospital at the time where the main outbreak started. And this guy denied all the questions. And so we cleared him and we said, this guy's just a regular flu. And the next morning, I went to see him in his hospital bed, and as I walked up to him, and I was wearing no protective gear at all, no mask, no gown, no nothing, he coughed a boatload of blood all over my face.
Oh, my God. Oh, my God.
And all of a sudden, everything changed at that moment. And it was a terrifying experience.
Yeah.
And he was a 37-year-old gentleman, father of 2 young children, and he died 3 days later. So it was such a terrible disease at the time. It took people from being completely healthy to dead within a matter of days when they had a bad infection. And unfortunately, we never really found out why he lied to us because from that point on, he was actually in the intensive care unit. He was too sick to breathe, too sick to talk. So we never really understood it. But, the lesson to me is that there's a huge danger in healthcare in that we really rely on patients to be honest. And especially here in this Ebola outbreak, honesty is the thing that differentiates the high-risk patient who we think has Ebola from the person that has the common flu. Because in the early days of Ebola, it's just like a flu. You have a fever, you have a headache, you have sore muscles, all that stuff that you have with the flu. And so especially with this Dallas case where the guy got on a plane, lied about the fact that he was actually carrying people with Ebola around over in Liberia, and that's how he managed to get over the United States. And I feel like we're going to see a lot more of that. It's the Achilles heel in our entire strategy to contain this illness. So it's very frightening. And when I go to work, I always think when I'm treating the person with the flu-like symptoms, is this the person that lied about where they came from? And could this be my next SARS-like exposure? It's very frightening.
I would imagine it's frightening. I guess the advice to give to people is, you know what, not only is it not an embarrassing thing if you happen to catch some major disease, you should deal with it the sooner the better because A, you're not putting other people at risk, but B, you're helping save yourself. Like maybe in the case of that gentleman who died of SARS, if he told you that day, there might have been a greater chance of his survival, correct?
Yeah, absolutely. And even in the case of the Ebola patient down in Texas, if he had been more honest and more straightforward during his initial presentation to hospital, and I'm sure you know that there was a bit of a bungle when he first came to hospital. They sent him home by accident because somehow they didn't communicate the information that he had recently come from Africa and that there was a chance that this was Ebola.
You think they'd probably be able to communicate that, though?
Well, yeah. I mean, listen, like they dropped the ball in a big way over at that hospital, and I can't lay blame. I don't know how that happened because I couldn't see that happening at my hospital. But that being said, had he said, "Hey, I was carrying around people with Ebola in Africa. I think I might have Ebola," he might be in much better shape now because what happened is they sent him home and he deteriorated significantly over the next 2 to 3 days. And the hallmark of good treatment for Ebola is aggressive replenishment of fluids, a lot of therapies we can do to try to minimize the bleeding and the complications and the organ failure, and that could have all been started much sooner. So those 2 or 3 days that he deteriorated at home may be the difference for that guy between living and dying. So I would urge anybody out there who has maybe a risk factor for these illnesses, be honest with healthcare providers because in the end, the person you're hurting the most is yourself.
I have herpes? Does that help? Maybe you have herpes. I don't know. Like, am I good now?
Certainly. I think you're great. Yeah, I think all questions from my left side now are going to me. I think what I've learned is the left side is the non-serious answers. To the right of me are the serious answers.
No, the right's pretty non-serious too. I'm just trying to make this somewhat educational for people, and I want you back again, right? So.
Well, I have heard herpes, and actually I can't even make this joke, but herpes when covered by a thick beard is harder to catch. So
yeah,
you are going in the right direction with personal grooming.
This is my protection.
No, but I actually think it's funny you brought up herpes because a lot of people and single people who date all the time are afraid to talk about STDs if they ever have them or had to have them. A lot of people don't like to talk about their history. And I think it's the same lesson you're giving to people. It's okay to be honest with someone because you're helping yourself while also saving someone who you might potentially care a lot about. And I'm not even talking the bigger ones. I'm not, even if it's just a cold sore or something. It's good to be forward with people. And people, I don't know, I think it's with age. Like people are going to love you for who you are, not for what you've had in the past or what, maybe you were exposed to by accident. Is that fair to say?
Yeah, no, listen, I think that's incredibly fair to say. I think, I mean.
I'm being serious.
No. But I think that the real answer is there is an amazing amount of dishonesty that we see in the medical profession around patients coming in and telling us what their symptoms are, telling us what their diagnoses are. And whatever dishonesty I see in the hospital is multiplied by a factor of 10 when it's person to person.
When you're dating at the club.
Yeah. I see a lot of dishonesty in my profession, especially when I ask the girl if she had herpes. She said no. Now I have herpes. So we're a lot alike.
I do notice a trend in this show that whatever topic we talk about on the show, it tends to go below the belt very quickly.
Yeah. We're not very smart. That's why.
Really, I've noticed 2 times on the show, and herpes has come up both times.
It's a pretty common theme here.
But listen, I think. In terms of diagnoses that are worth speaking about, Ebola is one that's really important, and herpes is hugely important as well. So I'm glad that we're talking about it. There is an epidemic of herpes out there.
Is there actually an epidemic of herpes? That's fucked. Sorry. I'm so happy I'm married. Like when you hear stuff like that.
There's 2 herpes viruses, and there's the virus that causes cold sores around the mouth, and there's the virus that causes cold sores down below. And, when they screen the population, about 90% of people test positive for having been exposed to the cold sore virus that goes around the mouth. But, the common misperception is that one has nothing to do with the other. But somebody who has a cold sore around the mouth who happens to be involved in oral sex with somebody else can give that person genital herpes with that same virus. Less likely, but still possible. So you're looking at 90% of the population. I would say that's a bit of an epidemic.
Wait, did you just say less likely, though?
Well,
I saw a sign of hope in that. There's some sense of optimism from you, which is actually fairly rare, Dr. Brett Belchetz. And thanks for joining us, by the way, again. So I just thought it was a given that if you had it on the lips and then you went down below and you were doing that thing, which, some call blowjobs. But that's right term, right?
Well, no. Yeah, as a medical professional, I probably shouldn't be using that exact term.
No.
But it is good that you take it as a given. A lot of people don't get that. So there are a lot of people that, for whatever reason, believe that cold sore around the mouth can't go to other parts.
Interesting.
So, and I see that a lot at work where they think it's a totally different illness. They don't understand that this is a herpes virus. If you have oral sex, when you've got that active lesion around your mouth with somebody, you can certainly pass that down to the genital region. So it's something to be aware of. And you really shouldn't have close contact with anybody if you've got an open cold sore. So not even kissing on the lips or not kissing your baby. Really,
little things.
Yeah, little things. Just watch out, because that thing is so contagious. It spreads like wildfire.
That's freaky. Is there more education we should be giving? Not only just STDs. Like, how is it that people, without making people feel fearful of stuff that may happen, whether it's Ebola, the headphones came out, Tommy, I help Dr. Brett Belchetz out, if you don't mind. But is there something we should be doing maybe to educating, whether it's high school students, I'm trying to figure out the balance between not making them hypochondriacs and not making everyone fearful of living life, but also understanding that there's repercussions and how you do it safely and cautiously.
Well, education is huge. And, I am an enormous proponent of starting sexual education earlier in life rather than later in life. And there's a school of thought out there which has been proven wrong over and over and over again, that if you give sexual education early in life, so in primary school, junior high, etc., that somehow we will raise the levels of sexual activity among younger people. And every study that's been done has shown that not to be the case. In fact, when they look at populations that have received sexual education in primary school, junior high, etc., they are actually the people who get sexually active later in life versus their peers who receive no sexual education. But yet, for whatever reason, a lot of very conservative groups try to block sexual education in schools. So I'm a big proponent. I think we should start it as soon as we possibly can. I mean, sexuality is human. It's what we do. It's how we reproduce. To pretend that our children should never learn about this seems to me backward. I don't know why we would do that. And I don't know why we would have a set of policies in place that put our children at risk of getting involved in things where they don't know how to do it safely, where they are at risk.
You wouldn't do that with anything else. You would go play hockey. You would teach them that you can't hit from behind right from a young age, knowing that they can't do that kind of stuff. It's sort of a similar analogy.
Well, I've noticed you keep talking about hitting from behind, but...
Oh, come on. You brought it there. Dr. Belchetz is now officially part of the program. Our training, our subliminal messages have worked very well. Okay. Oh, my goodness. See, now I'm thrown off. I had another serious question. Now I'm talking.
No. But you're right, though. I mean, if we talk about anything in life, our guiding philosophy with our children is let's show them how to do it safely. Let's make sure that they don't get into it too soon. Let's make sure they get into these, whatever it is we're talking about, that they do it at the right age. And when they do it, they know what to look out for, except for sex. There's a huge part of the population that for some reason says, let's let them wander into the wilderness and figure it out for themselves. And every study has shown among populations that are not educated, the STD rates are higher, the ages at which they become sexually active are earlier, the pregnancy rates are higher, everything goes downhill. There's no logic at all between waiting on sexual education.
Maybe they should just, and I'm kind of being serious when I say this without trying to be rude or disgusting in any way, but maybe they should just show films of women giving birth to kids, and they see that and they're like, whoa, I ain't doing any of that.
Yeah.
Forget about the STD side of things. Just like, that's what happens. Forget about it.
Well, yeah. I will be honest. I certainly trained as part of my medical education, and I've participated in delivering babies a number of times, and You know, it's something to see because it really isn't the beautiful thing that is portrayed in Hollywood movies. It's a tough process, and it's not all smiles and it's not all joy. And I think I don't know that we should be as graphic as doing what you propose. I think we might disturb a lot of children.
I agree.
But that being said, I think there is a realistic bit of education around what childbirth really is, what pregnancy really is, that is lacking in our schools and lacking in our popular culture.
Yeah, I went to a hot dog factory when I was a kid and seen how they were made. Never really enjoyed them at the ballpark after that. I'd be kind of worried seeing it up close.
Yeah. But I think what Brett was saying was Dr. Belchetz was just saying that we shouldn't show the process necessarily, but talk about the pain that goes through that eyeball didn't just fall off itself.
For sure, don't go to the hot dog factory then, right? Yeah.
Where is this said hot dog factory?
Yeah, it's pretty wild. Yeah, it was a guy's basement. I don't know what the meat was. I went to the wander into the wilderness and figure it out private school of life.
It's probably a good school, to be honest.
Yeah.
It's probably a very good school. Well, so I guess to the moral of this visit, Dr. Belchetz, I can't say your name today. I don't know why. I know why. Because I call you Brett because you're my buddy.
Yeah.
I've never ever called you Dr. Belchetz in my life.
Yeah.
But I want to say it more officially on the program. I think that's why it's confusing. Yeah. Hey, do you have a photographic memory? I've always wanted to ask you.
No, you know it's awful. I actually have a terrible memory.
No, you don't.
Well, it's funny. I was not to get into personal anecdotes, but I ran into an ex of mine the other night, and she was bringing up stories from about 5 or 6 years ago, and she remembered them in every detail, and I couldn't even remember any of these things, and it was disturbing to me how somebody else could remember events so much better than me. So I think, do I have a photographic memory? Like, horrible memory, and I'm actually getting it gets worse as I get older.
Interesting. I was just going to ask, so because doctors, and the only reason why I asked this is I had a conversation with my stepbrother who is a doctor, and one of the things he said, which I really appreciated, was in the creative industry, in this world of radio, every single day we create news. So sometimes we forget exactly what we did yesterday. Honestly, it's that quick. And we've had comedians on the program who a lot of people say, can you tell me that joke you told 2 months ago? And they forget it because they're working on news stuff. And I think the sign of a really good doctor is someone who doesn't necessarily remember what happened 3-4 years ago, but because medicine is ever rapidly advancing, there's so many different and new things you guys need to learn as well that sometimes you kind of forget the past as well. I think that's part of it, right? There's so much education there that's continuous in your world.
Well, the thing about medicine is that it's all about repetition. So I do things over and over and over again. That's what medical training is about. So, through about 10 years of medical education, every single disease you could think about, every procedure that I need to do, I probably did them hundreds of times. I saw them hundreds of times. Things get drilled into your memory. So, within the medical experience, it's very easy to have a good memory because you just do these things so many times. When I work on a day-to-day basis, when I see my patients, everything's documented. I write it all down. I don't really need to have a great memory because it's all on paper there. But to speak to your point in your job, everything is different every day. It's not the case in my job. Things are the same patterns, and I get to do things over and over. I don't have to really worry about my memory there.
One more question, but I don't want to sort of blow the gauntlet on this just one visit because I hope to have you back a lot, Brett, if you don't mind. But
no, it would be my pleasure to come back.
Great. Yeah. One of the things you're seeing it all over the news these days, where it's a lot of depression talk, and especially a lot in our soldiers and our officers, post-traumatic stress disorder, all these sort of things. It must make you happy to see that this is on the forefront now of people's minds and being more open about it and talking about it. Is there any advice you would give to even a Todd Shapiro Show listener? Say, hey, if you're going through some stuff, don't be afraid to speak to a professional.
Absolutely. So I think, similar, it's funny because we were talking earlier about STDs and the shame of people talking about their symptoms and the shame of seeing your doctor or talking to your partner. And interestingly enough, mental health is very similar. There, traditionally over the, past decades, there's been a huge amount of shame. So if you couldn't cope, if you had postpartum depression, if your moods were off, if there was bipolar in you or schizophrenia, it was something that you kept to yourself. You couldn't tell your peers. You couldn't tell your partner. People didn't want to go to their doctor and be the depressed patient coming in. And what's really great and what's changed over the last few years is the shame has started to disappear. And people are more and more being open to, number one, recognizing the signs that they are suffering from one of these conditions, and number two, seeking help. So what I would say to anybody listening to your show, we all know what it's like to go through a tough experience in life. We all know, you had a bad breakup, you lost your job, whatever it is. We all have a tough time with that and struggle with that. But when you're going through a time where A, that's not getting better, or B, there's something different about it. It's not in response to a particular life event, but this is just an ongoing thing in your life that just has no relation to experiences that you're having. There's nothing to be ashamed of. You should seek help from every part of your life. So you should seek help from your friends. You should let them know, because friends are our number one support in our lives. Seek help from your family.
I'm glad you said that about friends, because it's neat. It's a lot of people wouldn't want to go to the friends. That's the easiest way to maybe sometimes just to let things off your chest, right? Which could really lead to the step of you recovering. Is that?
Absolutely. I mean, you can take medications for these things, and medications really do help to elevate people's moods. But what I really think is important is long-lasting things that build up support mechanisms, things that change your behaviors in life. So, go to your friends, let them know you're having trouble, let them be your friend. People want to be a friend to those that they know need them. Go to your family, let them know you're having trouble, and also go to your doctor. Your doctor is somebody that needs to know what's happening. Your doctor is the person that can properly figure out, is this something that we need to look into medical therapy for, or is this a reactive thing that, this is life events, and counseling and behavioral therapies may be what we need. But they're the person that's going to differentiate the truly medical chemical depression from something different, or any other form of mental illness. And a lot of these things, people are very averse to medications. They're very scared of medications, and rightly so. We should be careful what medications we go on. But a lot of these things, the role of medication is it's a really helpful crutch to get people over the initial stages of a terrible mental illness. And as we get better and as we build support systems, we get the people around us to help us out, the medication becomes often a less important part of it. And what we build when we're able to with the medication in us is what keeps us going for the long run.
And it's just good advice for people addicted to Candy Crush. Same thing. Just talk to people, talk to friends.
And don't send invites to anybody, please.
What's with all the invites on Facebook? I mean, come on.
My question to anybody out there is, if you have a way to stop those invites from coming, please tell me. I can't handle it anymore.
That's a good app that blocks all the Candy Crush invites. That's what someone should do, filter. I love it. Well, listen, Dr. Belchetz, I really love when you're part of the program. You've been very helpful to me in my life. Obviously, whenever I need you, you've always been there for me. And, luckily, I'm a picture of health, Jay. I don't know if you know that.
Oh, yeah.
Yeah.
See it.
It's really unbleevable, actually.
You're glowing.
It's perfection. It's wild. But I think what I'd love to talk about you in a future visit is perhaps something that I need to learn more about, the effects of alcohol.
Yeah. Well, I mean, that I think could take a few shows.
Okay.
Yeah.
Well, it'll be a great few shows. And also, guys, it's the second time we've talked about Ebola. And just because you hear there might be cases in the States, and there was a potential one here in Toronto alone that didn't turn out to be. But don't panic. Don't freak out. There's not a zombie apocalypse. That's another thing you see on Facebook. This guy who came back from does that drive you crazy? The spreading of this BS when it comes to what's going on with this disease?
I mean, that's my noise of utter frustration.
Yeah.
So number one, first of all, the message you're giving about Ebola is right. Don't panic. Everybody's panicking. Do not. You're not going to get Ebola. You're not going to be exposed to it. It's not going to destroy the world as we know it. Zombie apocalypse, the other thing you bring up, it's not going to happen. Medical science does not support the reanimation of the dead. Just to be very, very clear.
So when you put it like that, how can you argue it, Yeah.
A lot of people that are superstitious. Do you have a lot of, you must get a lot of people in your office, I guess older people with bad information as far as medication or medical science. I had a conversation with my grandmother literally this weekend where she told me about a time that she had me as a baby, and I was like, I didn't recall. I'm like, you were with me when I was a baby. She's an alien. She's like, yeah, I see you, and one time you cry, I pick you up and I shake you. I'm like, no, what? She's like, yeah, and I shake you and you no cry no more. I'm like, yeah, it was probably brain damage. No crying. You couldn't after that. I'm like, oh, this old logic. Back in the day, she was just shaking 14 kids to sleep, right? You have to, have to educate people.
But earlier in the show today, I was questioning some of the biting behavior you're describing, and it does make a lot more sense right now.
That's none.
You said you had a bad memory. Dr. Belchetz, thank you very much for being a part of the program. Where are you on Twitter now?
So you can find me on Twitter. My handle is Brett Bell, BRETTBEL. Best way to find me. I update all the time. So if you're looking for updates on health emergencies, public health, or just what I'm up to in the media, look for me there. Follow me. It'd be great to have you.
Yeah, it's great too. I mean, it really does give you some very interesting perspectives that are educational, and he doesn't talk about herpes too much. And they're also, I know that you're doing stuff on CBC. You're on the Sun News Network at times, right? Mm-hmm. You still doing Marilyn Dennis show?
Yeah, I'm on there whenever they call for me. So usually it's about every 6 weeks or so. I'll do a segment on the Marilyn Dennis show. So I should actually October 15th, morning of October 15th, we're going to be talking about flu season. So if you're curious about the do's and don'ts of the flu and what to expect when you get sick with the flu, tune into Marilyn Dennis,
okay.
10 a.m. CTV, October 15th in the morning.
Perfect. And then on like the 17th or 18th, maybe you could come on our program. We'll do the do's or don'ts our way for the flu season.
Yeah.
Is that fair?
And I'm sure it'll have some sort of genital connection for sure.
I make a lovely flu shot myself. It's like tequila with salt and then like an orange peel in it. That's my flu shot. Gets me through every year. I get the flu still really bad, but
you feel fine while you have it.
Yeah, during that.
All I'm picturing as he says that is him getting shaken as a baby.
Poor Jay.
Yeah.
Oh man,
she had big hands. She shook the shit out of me. I'm assuming. So
I think this is a topic for another show.
Yeah.
It is. Thank you again, Dr. Brett Belchetz here.
Thanks for having me
on the Todd Shapiro Show on SiriusXM Canada Laughs Channel 168.